I'm Professor David Richards, Head of Nursing at the University of Exeter, and I've been a nurse for 33 years. Well, we have established a pioneering nursing academy in Exeter. Within 5 years, we aim to be the global leader in nursing education and research. This all sounds very grand. In simple words, if you're sick or someone close to you is sick, it will be the Exeter nurse that you'll turn to for help. So what is this Exeter nurse? I mean, the Exeter nurse will be highly skilled and they'll be a leader in their field. So our innovative program's got what we call 6 pillars, but I'll talk just about 3. The first one is that the Exeter nurse will know that there is no health without mental health. They won't just focus on your physical health, they'll also focus on your mental health because the two are completely intertwined. Secondly, we're going to focus our attention on the fundamentals of care. By that I mean the essential things that matter most to patients, to all of us if we're sick. Things like being clean, things like being fed, being mobile, being able to go to the toilet with dignity. These are things that we would do for ourselves that if we can't, the Exeter nurse will be able to help us with. And the third thing I want to talk about is being constantly curious. The Exeter nurse will always ask why we do things. How can we do things better? And they're never going to be satisfied with those old answers like, we always do it this way. So Exeter nurses will be a pioneering mission to find, use and produce the evidence for their own clinical practice. And all of that will be backed up by an academy in Exeter of the brightest and the best of nurses nationally and internationally.
I'm Alison Marchbank and I'm a very experienced nurse educator, passionate about educating future nurses and clinical excellence. I'm also the programme lead for the Master of Science in Nursing at the University of Exeter. We've designed a very innovative programme, but we've also designed it with small numbers of students in mind because we want you to have an exciting, enjoyable and fun experience because it's going to be demanding. So you'll be in small groups and you'll get to know each other really well. You'll have a very strong identity as an Exeter nurse and we as staff will know you really well. And that's important because we want to plan your career and your clinical experiences around what your aspirations are. So our unique Master of Science in Nursing will give you the opportunity to go abroad to do an elective placement. You can also do it in the UK, but it'll be somewhere really different and exciting for you to go and learn about different cultures, the way healthcare is organised. Our final year will take you beyond the traditional adult nursing programme. You will be able to specialise, so you may choose to qualify as a mental health nurse. You may also choose to specialise and advance your clinical practice, develop your education capability, or leadership or global health